Have you ever stopped to think about how your habits during masturbation might affect your prostate and overall health as you get older? It's something many men overlook, but the truth is, what might have been harmless in your younger years could actually cause real damage now. Imagine sitting alone in your favorite chair, hoping to relax and enjoy some quiet time, but instead feeling unexpected discomfort or irritation that wasn't there before. That simple moment of pleasure turns into a source of pain or worry, all because of small habits you didn't even realize were risky. It's frustrating, confusing, and can even affect your confidence and well-being. In today's video, we're going to uncover some common mistakes older men make during self-pleasure. Mistakes that can lead to discomfort, infections, or even long-term prostate problems if ignored. Whether it's holding in your urine, using too tight a grip, or relying on unsafe products, these habits can silently impact your health without you knowing. But don't worry, knowledge is power. I'll share practical, easy-to-follow tips to help you protect your health while still enjoying pleasure safely and confidently. Because masturbation isn't just about physical release, it's about respecting your body and mind, especially as they change with age. So if you're curious about how to keep your prostate happy and avoid costly mistakes, stick with me through this video. Your health and happiness matter, no matter your age. Mistake number 1, ignoring the urge to urinate before self-pleasure. One of the most overlooked but potentially risky habits among older men is skipping a bathroom trip before self-pleasure. You might shrug it off, thinking, "I'll go afterward." But if you're over 60, that delay could be setting you up for discomfort, or even a urinary tract infection. As men age, the bladder becomes less flexible, the prostate gland tends to enlarge, and the urinary tract doesn't empty as efficiently. During arousal, pressure builds in the pelvic area. If there's urine still sitting in the bladder or urethra, that pressure can cause it to backflow, leak, or get trapped. This can result in unexpected leakage during or after the act, and in more serious cases, it increases the risk of bacterial growth and inflammation. There's also something called post-void dribbling, when urine leaks out after you've already finished urinating. It's more common in older men and can be made worse by not emptying the bladder before engaging in physical stimulation. Combine that with the friction of masturbation, and the urinary tract becomes a vulnerable, irritated environment, ripe for infection. Consider the case of Richard, a 75-year-old retired firefighter from Ohio. He went to his doctor complaining of burning during urination, frequent nighttime urges, and some embarrassing leakage. He feared something serious, possibly prostate cancer. But after a thorough checkup and negative screenings, his urologist traced the problem to a habit Richard never thought twice about: delaying urination before self-pleasure. Once he started relieving himself beforehand, his symptoms reduced drastically within a week. "I felt foolish," he later shared, "but I learned it's not about pride, it's about being smart with your body." There's also a psychological layer to this. Many older men have learned, consciously or not, to ignore bodily signals. Decades of rushed intimacy or private discomfort around self-care can lead to habits that don't serve you well in your later years. But honoring those signals, especially when it comes to your bladder, is not a weakness. It's an act of respect toward your health. If this sounds familiar, if you've ever wrapped up and suddenly felt a painful urge to pee, you're not alone. Make it a personal rule. Always urinate before any intimate activity. You'll avoid discomfort, reduce your risk of infection, and feel far more at ease physically and emotionally. At this stage of life, comfort and care matter more than speed or routine. Listen to your body. It knows what it needs. Mistake number 2, treating your body like it's a machine. As men grow older, one of the quiet but damaging habits they often carry from their younger years is using too much force or rushing through moments meant for pleasure and connection. It might sound harmless, but how you treat your body during solo intimacy matters more than most people realize. In your 20s or 30s, maybe speed and intensity felt like the key to satisfaction. But with age comes wisdom and change. What once worked may now be leading you down a path of numbness, frustration, and even emotional disconnection. Here's the truth: using a tight grip or moving too fast during self-pleasure doesn't just affect your short-term experience. Over time, it can actually reduce your sensitivity. The nerves around the penis are delicate and responsive, but when they're exposed to repeated, intense pressure, they begin to dull. Think of it like loud music. The more you blast it, the less clearly you hear. Many men don't talk about this, but the effects show up in subtle, painful ways. Some find it harder to enjoy intimacy with a partner. Others struggle to climax without extreme stimulation. And worst of all, they blame themselves or think something's broken, when in reality, it's simply a habit that needs rewiring. Take Robert, a 68-year-old retired Navy veteran from Florida. After months of frustration, he confided in his doctor that he felt numb during intimacy with his wife of 40 years. Through gentle conversation and education, he realized he had unknowingly trained his body to only respond to one kind of stimulation: tight, fast, and mechanical. With time, patience, and a shift in approach, he was able to reconnect with his partner in ways he hadn't felt in years. It wasn't about performance anymore, he shared. It became about presence. And here's another important point. Fast, intense stimulation isn't just a problem for sensation. It can also take a toll on your health. As we age, our cardiovascular systems become more sensitive. Quick, forceful activity can lead to spikes in blood pressure, lightheadedness, or even irregular heartbeat. That's not pleasure, that's a warning sign. So what can you do? Shift your mindset. Start by loosening your grip. Use your whole hand or explore gentler touch. Slow your rhythm. Focus on how it feels, not how fast you can finish. Listen to your body and let the experience be about connection, not completion. You're not losing your power. You're learning to use it wisely. Aging doesn't mean giving up joy. It means rediscovering it with more depth, intention, and care. If you've made it this far, I truly appreciate you. Drop a number 2 in the comments to let me know you're here and still with me. Your presence matters. Stick around until the end. I have more insights coming that can genuinely transform how you approach your health, pleasure, and confidence in this stage of life. Let's grow together. Mistake number 3, ignoring your prostate's quiet signals. Most men don't realize how deeply connected their solo pleasure habits are to prostate health. But here's the truth. Masturbation can be a helpful tool or a hidden risk, depending on how well you listen to your body's subtle cues. The biggest mistake? Ignoring the small warning signs that something isn't quite right. Maybe you felt a dull ache or pressure during or after climax. It's easy to dismiss it as just getting older. But this discomfort could be your prostate sending you a clear message, one of inflammation, irritation, or enlargement. Conditions like prostatitis, prostate inflammation, aren't rare, and they don't just appear out of nowhere. They often start with these quiet signals. You might notice a strange soreness deep in your pelvis or behind the scrotum, especially after sitting for a long time or even during bowel movements. If this hits home, your body isn't trying to bother you. It's asking for care and attention. The danger lies in how many men respond. They push through the pain, hoping it will disappear on its own. Continuing the same habits that cause strain, like frequent, forceful masturbation, can be like running on a sprained ankle. Instead of healing, you're adding fuel to the fire. Let me share a story. Tom, a 74-year-old retiree from Texas, ignored mild pelvic discomfort for months. He brushed it off as normal aging, confident it would pass. When he finally saw a doctor, the diagnosis was chronic prostatitis, a condition that had worsened because he didn't act sooner. His recovery was tough and slow, but he learned a vital lesson. Listening early is key to healing faster and living better, and the signs don't stop at pain. A weak urine stream, the sudden need to go more often, especially at night, or feeling like your bladder never fully empties are all red flags that your prostate needs attention. Masturbating through these symptoms isn't helping. It could make inflammation worse and delay your body's natural recovery. So what's the takeaway? Your body speaks softly at first. Those whispers matter. When you hear them, slow down, rest, adjust your habits, and never hesitate to talk openly with a healthcare professional. There's no shame in asking for help. In fact, that's true strength, because real power isn't about ignoring discomfort or toughing it out. It's about respecting your body enough to care for it and yourself with patience and wisdom. Sometimes the hardest and most rewarding part of this journey is learning to listen, not just to what our bodies say, but to what they need. This quiet awareness becomes the foundation for better health, deeper satisfaction, and a life lived fully on your own terms. Take a moment today to tune in. Your future self will thank you. Mistake number 4, using unsafe products or improvised tools. What you use during your private moments matters just as much as how often you enjoy them. Sadly, many men later in life unknowingly put themselves at risk by turning to lotions, gadgets, or homemade aids that might seem harmless, but actually cause lasting damage. This is one of the lesser-known but serious hazards of aging and self-pleasure. Imagine this. You're sitting alone in your room, hoping to recapture the sensations you remember from years ago. Sensitivity isn't what it used to be, and you're searching for that spark. You reach for a lotion or a gadget lying nearby, maybe something you've put together yourself to boost the experience. At first it feels okay, but then, a few hours later, or maybe the next day, you notice redness, soreness, or even a burning feeling that wasn't there before. What began as a moment of pleasure turns into discomfort and worry, and suddenly something meant to bring you joy has become a source of pain. Take personal lubricants or oils, for example. Many men pick up whatever's on the shelf without checking the ingredients, but harsh chemicals like alcohol, artificial fragrances, or preservatives can wreak havoc on aging skin. As we get older, our skin becomes thinner and more fragile, making it far more prone to irritation, allergic reactions, and slow healing. Even minor irritation can lead to painful rashes or cracks, opening the door to infections that could take weeks to resolve. Then there's the temptation to upgrade your experience with homemade tools or everyday objects that weren't designed for delicate use. Whether it's a household item or a device without safety features, these can cause tiny tears, nerve damage, or bruising, especially risky if you have circulatory issues or prostate concerns. I remember talking with Walter, a 68-year-old gentleman from Michigan, who tried to enhance his solo sessions by using a custom-made device he'd crafted at home. What started as curiosity quickly turned painful. He developed swelling, discomfort, and even occasional bleeding. By the time he sought medical care, he was battling an infection that required antibiotics and a lengthy recovery. His embarrassment had kept him from getting help sooner, making things worse. The takeaway is clear. Prioritize your health by using only products designed specifically for intimate use. Choose lubricants that are gentle, fragrance-free, pH-balanced, and made for sensitive skin. If you want to explore toys or other devices, do your research and consult a healthcare provider or trusted sexual health expert before trying anything new. Your body deserves respect and safe care, not risky experiments. As we age, wisdom means making smarter, not riskier, choices. Solo pleasure can be deeply rewarding at any age, when it's done with care and respect for your changing body. Protect yourself by choosing the right tools and products. Your comfort and well-being depend on it. Mistake number 5, ignoring emotional well-being. This is perhaps the most underestimated factor. Many men between the ages of 60 and 85 don't realize how deeply their emotional and mental state can affect and be affected by their sexual habits. Loneliness, boredom, anxiety, or even depression can quietly drive compulsive or excessive masturbation, not as a means of pleasure, but as a distraction or coping mechanism. And while occasional release is normal and healthy, when it becomes a substitute for connection, emotional expression, or stress relief, it can leave you feeling more empty, not fulfilled. One gentleman I met, 71-year-old Richard, said he was masturbating daily but felt worse after every session. Not because the act was wrong, but because he felt emotionally disconnected. It had become routine, not rewarding. He missed the intimacy and connection that used to surround the act. Here's the truth. Your emotional state matters. Masturbation is a personal experience, but it doesn't have to be isolating. Sometimes reaching out to a therapist or support group, or simply talking to a trusted friend can create healing far beyond the physical. Your mental health is just as important as your prostate health. So if you've been using self-pleasure to escape rather than enjoy, it might be time to gently shift your perspective and your habits. Masturbation itself isn't harmful, but as we age, the way we approach it, the habits we develop, how often we do it, and the reasons behind it can have a big impact on our health and happiness. One key mistake is holding in urine during the act. Always empty your bladder first to avoid complications. Another is gripping too tightly or rushing through the experience. Relax your grip and slow down to make it safer and more enjoyable. It's also crucial not to ignore warning signs from your prostate, like pain, pressure, or changes in urination, as these could signal underlying issues. Using unsafe products or improvised tools is another risk. Sticking to medically approved lubricants and devices designed specifically for intimate use protects your body from harm. Finally, never forget the importance of your emotional well-being. True self-care embraces both mind and body. If any of this resonates with you, I'd love to hear your thoughts in the comments. And if you know someone who could benefit from these insights, sharing this information might just change their life. Remember, your sexual health is a vital part of your overall wellness. With thoughtful habits and respect for your changing body, you can enjoy fulfilling and safe intimacy at every stage of life. Thanks for watching, and take great care of yourself. You deserve it.